I spoke with Sunita Reddy, MD at Apollo Hospitals Enterprises, about what the healthcare sector is expecting from the budget. I asked her what her expectations were, given that the government's fiscal constraints are there, and there is an expectation that there may be an increased spending for rural India. Could spending on healthcare be affected?
I don't think that this government will ignore healthcare. The fact is that while they do look at the fiscal deficit, there is a huge need to really improve our infrastructure. I think for just our cities, urbanization, we need to put 50 billion into infrastructure. And the whole government is talking about Make in India. If you think of all the investments that are required for India, you have to think about the people who are really required to make them successful. And that's why I think healthcare plays a very important role. Currently, we have 0.7 beds per thousand, which is abysmally low. We need to have at least 3 beds per thousand. But besides the infrastructure which we need to invest in, and we need to attract that money, because all of us know that India alone cannot raise that much money or allocate that much money, which is close to 30 billion US dollars. But working with the private sector and incentivizing them is a good way to do it, is a good way to set up that infrastructure. So I would think that, instead of phasing out sections like 35AD, which is a weighted deduction on capital, it would be so much better if they would leave everything as it is, because we are not asking for anything extra. We're saying give us some more time, because this is a sunrise industry and the opportunities here are immense. For every $1 that's invested in healthcare, you get $4 of ripple effect, which has an impact on employment, job creation, which is extremely important, manufacturing, which is why I think, that healthcare has immense potential. And I do know that the government is doing something to look after the health of people. So right now, they've talked about universal health coverage. Looking at that scheme, I think it's a great step that the government is doing, because they're increasing government spend from 1% and which is to almost 2%, which I think is critical for the country. But while doing so, I wish that they had really worked with actuaries and looked at the actual costing. If they had done that, they would have realized that the coverage needs to be much more.
Do you also think that this time in this budget, the government may also come out with some sort of SOPs for the medical tourism in India particularly?
Well, I think they made a start when they said that they would give visa on arrival in the last budget. But I think a lot more needs to be done. And clearly, the External Affairs Ministry, the Health Ministry and the Home Ministry need to get together to issue the health visas, which is something that is not happening. Currently, if you look at medical value travel, it's close to 80 billion. And India gets barely 1% of it, even though the value proposition that Indian healthcare creates is tremendous. We operate at 1/10 of the cost of the US, 1/5 of the cost of Singapore, and 1/3 of the cost of Thailand. So you can imagine the benefit that would accrue, and also the export earnings that we could get by doing something like this. I think it would be a wonderful foreign exchange earner for India if the government were to encourage medical value travel.
It's been a long-standing demand of the healthcare sector. Do you think this time around you will get the infrastructure status and the 10-year tax holiday?
It's unlikely that we'll see this happening right now, because I think the focus of the government is to change some of the taxation laws and to bring down taxation as a whole. So we're just hoping that the existing benefits that we have, which is Section 35AD, will remain. And in addition to that, we do have a 5-year tax holiday for new hospitals which are over 100 beds. So if that is extended to 10 years, that would be realistic in my sense, and something that I hope the government will take cognizance of.
And what's your expectation as far as health insurance is concerned? We understand that the government has already stated its goal, coverage for all. Do you expect government to really come out with some sort of subsidies or greater subsidy to get this coverage for all?
It should change. Right now what the government is proposing is universal health insurance, and they're giving you a benefit of 50,000 rupees and an additional 20,000 rupees, I think, for senior citizens. But I think they need to, it would have been nice if they worked with an actuarial and the policy reflected the true cost of healthcare, which is why I think, the private sector should really be working with the government. There has to be a contribution of both that comes from the private, the individual, either in the form of contributing towards a portion of his salary towards healthcare expenses. The government alone cannot handle the healthcare expenses of the country, and I think this is clearly where the private sector has to come in. I mean, if you can have a Swachh Bharat cess or an education cess, why can't you have a healthcare cess where we all contribute towards the healthcare of our nation?
So a healthcare cess is also something that is being coined by Ms. Reddy. But are you expecting any kind of incentives for setting up private medical and nursing colleges? Because as the infrastructure comes up, you need the manpower as well.
I wish they would, because if they did, it would take some of the burden off them. We need to double the number of nurses, we need to triple the number of nurses, double the number of doctors, and quadruple the number of healthcare technologists. So for the government to do this is a tremendous task. The private sector definitely can do it, but to make the system really transparent, I believe we have to corporatize it. And then we'll also bring quality. What I would love to see is, researchers, professors, our Indian professors who are teaching abroad come back to India. I would also like to see the outflow of foreign exchange that goes towards education stay in India. These are huge opportunities, and it's having the world's youngest population. We should take advantage of that and educate them properly, because when you give them this sort of education, you guarantee them a job.
So that was the management of Apollo Hospitals talking about their expectations from the budget.